Today we're going to talk about skin rejuvenation for women in their 50s, what it is, what are our options, and things to avoid to keep you out of trouble. So if you'd like to know more, please keep watching. Hi, I'm Shelley. This is Fabulous50s, a lifestyle channel that celebrates women in their 50s. And today we have a beautiful woman in her 50s, Daniela Boerma, and she is a multi-award winning beauty therapist. And she does consulting for all the different machines that are available to help us rejuvenate our skin. Daniela is going to share with us things to look for when you're trying to decide what treatment to get.
What we need to know basically is where we're going, whether the treatment facility is accredited, whether they're registered, whether or not their machinery is actually TGA approved machines, which means Australia has approved them to be safe. Not all machines need to be TGA approved, but if you're going to go into ablative treatments, that means treatments that burn the skin to rejuvenate the skin, you're going to have to know that that's TGA approved. So you have to actually ask some questions before you decide to go ahead. If the salon wants you to have the treatment straight away without test patching, don't do it. Every ablative treatment or rejuvenation treatment that requires topical anaesthetic generally will require test shots, because if you're going to have a nasty side effect or be slightly over-treated or slightly under-treated, you'll find out through test shots. The CO2 lasers or the erbium lasers, they're a little bit outdated now, but in my opinion shouldn't be used by beauty therapists. I think they're too risky, and there are other pieces of equipment that can give rejuvenation to the skin that's a lot safer. We do a lot of microfractional treatment with radiofrequency, so that's when little needles or pins enter the upper layers of the skin, slightly ablate the skin and penetrate the skin or perforate the skin. This causes collagen production to heal the surface of the skin, and it's very effective. We get great results right through from scarring, from acne, to pigmentation, slight pigmentation, evening out that complexion. Very good for tightening pores. The skin sheds really within about 7 days, so you get a nice result by the end of the week. See, we use a machine by Polygen. It's called the Divine Pro. It's an amazing machine. It has two functions. It has the microfractional treatment, and it also has radio frequency with DMA. DMA is a new technology that's just been released. It's called deep muscle activation. So we're actually tightening the skin, but we're also activating muscle. So
like
it's never really been done before, like building muscles at the gym. Yeah. We're actually exercising the face, the facial muscles. Because if the facial muscles are taut and firm and activated, then it's a great support structure for the skin. So the skin with radio waves can tighten on top. So it's a fabulous treatment.
So if someone wanted to get that treatment, should they get their skin right first, or should that be done first?
Yeah, we always do a consultation first. We usually recommend a nice facial treatment to prep the skin. Home treatment products, we recommend Biodroga. We are a Biodroga salon. I'm the ambassador this year for Biodroga, and it's a great honour to do that because I've been using the product and selling it for 34 years. So it's a fabulous prep treatment program for any kind of ablative treatment or any treatment with heat. Because with radio frequency skin tightening, we actually raise the temperature of the skin to 40 degrees. So if we're just doing skin tightening, we prep the skin with hyaluronic acids, which hydrate the skin. Yeah. We know that radio frequency is attracted to water. So if the skin's highly concentrated with hyaluronic acid, you're going to get a much quicker and more effective tightening response. If you want a deeper rejuvenation for women in their 50s, we'd go for the deeper penetrating.
And will that get rid of wrinkles? Does that
help? It will help diminish fine lines. Yeah. It's not a facelift. It's going to give your skin a subtle but effective tightening. And this will prolong you thinking about other options that are more surgical or more invasive.
If women who don't live in Sydney, which is where you're located, in South Sydney, but if they're not, where would they find information on Divine Pro? Because I've never heard of that before.
Okay, so Divine Pro is by a company by Polygon, which is distributed through a company in Melbourne called the Global Beauty Group. So I would recommend anybody wanting to have the Divine Pro, they can call the Global Beauty Group in Melbourne and they will give you a list of all the salons that actually use their machine.
And this is brand new.
This is brand new technology.
People wouldn't have heard of this before.
It was only launched, I think, last year, late last year.
Okay.
Yeah.
So, but it does give really great results.
Amazing results.
So this would be something that women in their 50s could have a go.
Definitely.
And they'll see, yes.
Definitely. In fact, I've got clients that have stopped having filler.
Okay.
And
really?
Botox. They've just,
really?
Yep, they've decided that
wow.
their results have been so good. The treatment itself is instant. Obviously, the more you have, the better the result will be. We always recommend a course of treatment.
Okay.
So usually 5 to 10 treatments, one a week.
And what's the price range for that?
Well, it will vary from state to state. We charge around $200 per treatment.
Okay, so it would be about $1,000 for 5.
Yeah, roughly.
Which is what someone would pay for filler anyway.
That's right. That's right.
And it's it's non-invasive.
Non-invasive, and the beauty of it is also that it's like the gift that keeps giving.
I love
6 months
that.
down the track, you're still getting collagen induction therapy from the package that you may have had at the beginning of the year.
If that's too much money to afford, is it going to be benefit for people just to get one?
Even
or
one treatment
two,
will
and they're going to
benefit.
feel great that
Absolutely.
they've tried something new
100%,
and they're excited about having some sort of change.
In fact, we get lots of people coming, say, before their daughter's wedding or their son's wedding, 21st, all the family occasions that you just want to look fresh.
Okay.
It actually really gives you a lovely definition through the neckline, cheekbones, jawline. We get great results.
I want to get that done.
It just sharpens everything up.
Like Facetune, which is a beauty app for photos.
Yes, a bit like that, before and after.
That's really exciting.
Radio waves been around a long time, but the machines are just getting more state-of-the-art every year.
Yeah, because technology is just going ridiculous, isn't it?
Yeah, yeah.
Okay, so if you're wanting to try something and you don't want to spend too much money, have one go.
You can
see
the
benefits
100%.
And maybe get a voucher or something.
Christmas voucher.
For Christmas or birthday to get some more. That's a way to afford it.
Exactly.
What about women in their 50s who spend all their life in the sun and they've got nice big sunspots?
Okay,
what's the best thing that we should use for that?
Okay, so we've gone through the CO2 and the erbium lasers, which would be great for pigmentation and rejuvenation, but if you want to do something that's not as invasive or as deep
or as dangerous,
we do IPL pigmentation removal and skin rejuvenation. We get great results with that.
Okay.
If you find a salon or a therapist that's quite experienced in that area, that would be my choice. We also use a Q-switch laser, an Nd:YAG Q-switch laser. We're lucky enough in our salon to have the Tri-Beam. The Tri-Beam is a very, very good, powerful machine. It's quite high-end, and that performs beautifully and gives us an amazing result. Okay. What we can do with that machine is isolate a freckle the size of a pinhead if we want to, with one shot, and it will be attracted to the pigment in the skin. It will shatter the pigment cells. The body will then absorb the cells, and some of it will topically shed, and that gives a really nice result. And that's a little bit less invasive than IPL because we can just do the odd spot in the areas.
So would you do your whole face in that one?
I probably wouldn't. I would do IPL over doing... but I have a lot of ladies that go, I don't want that invasive IPL treatment. It's painful and it's a bit scary, and I understand that. I've had all of these treatments and they are scary and they do hurt. Let's face it. Beauty is pain. But you've got the option, if there's one big freckle or sunspot that you want to have removed, we can just do that with that machine, with the Tri-Beam.
Okay.
We predominantly use that machine for tattoo removal because it works at shattering pigment cells. But it can work on pigmentation spots as well.
Okay. Because a lot of ladies I know they've got one.
Yep.
And they don't really know whether they need the whole face done. So this is a great option for those ladies.
Exactly.
Okay, that's great. And what do we do for little veins?
Okay, so again,
those horrible little veins.
We can use the tri-beam on a different wavelength. That's very effective on blood vessels, broken blood vessels.
Okay.
Also, we have a machine that we use. It's called, it's a radiofrequency machine again, with needling. So it's a single needle, disposable needle, and it delivers radio waves. And we tap along the blood vessel. It cauterizes the vessel. The skin becomes quite inflamed. The vein itself will just sort of coagulate, dry up, and then absorb into the body.
Oh, okay.
And that's been very effective for blood vessel removal as well.
Great. So we can rejuvenate our collagen. That's everything, isn't it? And this is what all of these treatments do. They just rejuvenate our collagen. Yep.
So we trick the skin into thinking that we're really severely wounding it, so that all of that collagen starts to produce and migrate to heal the skin. And that's how we get our collagen induction and tightening over a longer period of time.
So all of these
it's a natural process. It's fabulous.
Yeah, because it's
totally natural,
healing like a cut.
That's right. That's exactly right. So we're not necessarily injecting filler or doing anything artificial. We're making you work for yourself.
Okay,
really.
That's a really good explanation.
Yeah. I actually had a meeting with a fabulous plastic surgeon the other day in regards to what, the new technologies are around, also not just in the beauty industry, but in the medical industry.
Yeah.
A lot of plastic surgeons are now doing fat grafting, and, it's amazing what can be done. Instead of using injectables, they're actually using our own fat. So they're doing a little bit of, like, say, for instance, a little bit of liposuction through this area, and then it's being injected through the nasolabial folds, around the lips. So that's your fat being injected back into your body. You're not putting a foreign body back into your body.
Okay.
This beautiful doctor, Dr. Rima Hattie, she's just amazing. She's in the Sutherland Shire. She is all for naturally, rejuvenating.
So you'd call that natural? It's
out
and then
I've never been a fan of filler, but I'm actually thinking. I've just turned 50. Over the last 12 months, I've been thinking, never say never, but I love the idea of using my own body fat.
Yeah, I like
Well, let's face it, we've all got little pockets of body fat that we would like to have removed.
Yes.
And put in areas that we need it, because as we get older, this is the first area of our body that loses fat, is our face. That's why our face drops, and we get these little bits here and there, and so I'm all for that.
Okay,
I'm
really
starting to come around with a few other options.
Okay.
So
can I just ask you? You said one of the things that can go wrong, something to be really aware of when you're out doing research, is the CO2 laser. If it's done wrong, it can stop you from producing fat in your face.
It can damage. It can actually damage the fat cells, and it can damage your skin. So if it's done incorrectly, or if you're over-treated, the damage is worse than what you realise.
Because we need our fat in our face.
We do need fat in our face, exactly.
Yeah, as we're ageing.
And some of these really aggressive treatments can affect our fat. So you've got to be really careful that the machine operator I believe they should be a dermatologist, a certified dermatologist, to be doing CO2 and erbium lasers. That's only my opinion, but
who would want to risk? Like, we don't want to risk
no.
anything. We want to rejuvenate and make ourselves look better.
And there are fabulous dermatologists that do erbium and CO2 that do an amazing job. So leave it to
the doctors.
Yeah.
Okay. So that's a really good tip for. We don't want people to make a massive mistake and then they're just.
That's right. And we treat a lot of women post CO2 and lasers that have damaged their skin to try and get their skin back. And it's very difficult. Wow. So
I'm really glad I know that. Cause
a lot of women just go straight into the treatments and think, I'll just have some resurfacing done. And there is negative sides to doing deep lasers with people that don't know what they're doing. So
I would have done that because I want to get rid of these lines here, and there's some great photos of older ladies with really wrinkly skin, and then it looks amazing. So I'd be drawn to, oh, that looks good, but I'm not going to risk. I don't want to risk it.
No.
Until the technology may be better.
And remember
different.
Also, people only put up their best work.
Oh, that's so true.
You know, when I research, when I want to, you know, if I was thinking about doing any kind of plastic surgery, I would be leaning more towards experience.
Yep.
I think doctors that don't put a lot of content on their websites, before and after photos, I don't think that's a bad thing. I actually think, you know, what I just said about, you know, doctors only put their best work up. It's very true. You know,
that's
like
true.
Just because a doctor doesn't have a lot of photos on his website doesn't mean he's not an absolutely brilliant doctor.
Yep. Yeah, that's really true. So much to think about.
Thank you.
I've learnt a lot, and I hope you've all learnt something too. So let's do some great stuff to make our skins look better, but research. Thank you for watching. Please subscribe if you haven't already done so. And thank you, Daniela.
It's a pleasure.
And have a great day.